And the timing of all this, of course, isn't great, especially within the IU Health network of hospitals. There are hundreds of IU Health employees now suspended after not getting their COVID-19 vaccine before the company's deadline of September 1st.
Obviously, unfortunately, coming at a time when they're already stretched for staff. Karen joins us with a closer look at this, how it's playing out here at the hospitals. Good morning, Karen.
Yeah, good morning, Julia and Julia. So IU Health says most of its doctors, nurses, and other staff are vaccinated, but listen to this. Just under 300 employees who did not meet that deadline are now in jeopardy of losing their jobs. They will be placed on a 2-week unpaid suspension, and during that time, health leaders say that they will be allowed to return to work if they provide proof of a partial or a full vaccination. Now, looking ahead to Monday, the hospital system says that they will temporarily suspend all inpatient elective surgeries and procedures. The change is needed, they say, so they can have more space and staff to care for a growing number of COVID-19 patients. Routine outpatient procedures like colonoscopies, those will not be affected. And Julie and Julia, now, IU Health tells me that many of their employees who are not vaccinated are not clinical or frontline healthcare workers. So again, Julie, you mentioned, this comes at a time when we are in need of nurses and healthcare officials, but we just have to see how this plays out. Again, they have 2 weeks to decide if they're going to get the vaccine. If they don't, then unfortunately they will be out of a job.
Yeah, it's really not encouraging to hear. Of course, we saw at the beginning of the pandemic a lot of people choosing or not having the option to get some of those elective surgeries done. So hoping that we are keeping a close eye on that. Thank you, Karen.
Yep.